Hello and welcome to Health Talk. I'm your host, Angela Baracco-Eddy. With me tonight is Dr. Faris Hakim. He is a board-certified gastroenterologist with the Sacred Heart Division of Gastroenterology Associates. You can find him at the Endoscopy Center on Davis Highway, as well as Sacred Heart, and I believe the office in Pace as well.
Yes.
From time to time, yes?
Yes, once a week.
Once a week, see?
Yeah.
There you go. Tonight's topic is something that's brand new. It's something that we will be introducing to this area, something that no one else is doing here yet. So Dr. Hakim and another physician or two at the Endoscopy Center will be starting this. The Orbera, I think I'm saying that right, Orbera
Correct.
Gastric Balloon Weight Loss System. So we'll be talking about this in quite a bit of detail this evening. We are live tonight, so if you have any questions, we'd love to get your comment or question on the air. The numbers will be flashing on the screen throughout the evening, the 432-7768, or if you're outside of the Pensacola area, the toll-free number is 1-800-950-2522. And again, we are going to be talking about the Orbera Gastric Balloon Weight Loss System. We were talking a little bit before the program about why this is important and why, and really the reason is because obesity is such a problem here in this country. So let's talk a little bit about obesity in this country and in the world, really, before we kind of get into too much detail.
Absolutely. Good evening. How are you doing today? Obesity is, unfortunately, is going to be the endemic of the so many years to come for this country and globally. We have much more obese people here in the U.S. Comparing to the rest of the world, unfortunately. Most probably because of our diet, supersize and sedentary lifestyle. Nobody works out as they're supposed to, and we eat a lot, unfortunately, so that's why. The obesity is defined by something we call the BMI, or the body mass index, that is calculated based on the body weight and body height. So anybody who has a BMI more than 25 is considered overweight. Between 18 and 25 is a normal BMI considered by the World Health Organization, and less than 18 is underweight. You don't see much of these around here. And overweight, there's several categories for obesity. Between 25 and 30 is overweight. Over 30 is three classes, 1, 2, and 3. Between 30 and 35, and 35 and 40. Over 40 is called morbid obesity, which is that doesn't go higher than that. Over 40 is morbid obesity, and the higher the weight, of course, the more complication that would occur with that. And that's a long list of things that is related to being overweight or being obese. Mention a few: high blood pressure, diabetes, high cholesterol, heart disease, hormonal imbalance. Most cancers have been associated, especially colon cancer, has been definitely associated with obesity as well. So a lot of things can result, bad things can result from obesity. And losing weight is, something that everybody is trying to do at one time or another in their life, just to, compensate for our habit, unfortunately. And diet and exercise is basically the base. If you think about losing weight as like a pyramid, the bottom floor is basically exercise and weight loss. The top floor, or the tip of the pyramid, is surgery. And having a bypass surgery or bariatric surgery, there's different type of surgery available for weight loss, and that will be the top of the pyramid. In between, there's a lot of things. There was a lot of medication that's been utilized over the years, nothing really being very effective, nothing really like a super bullet or a pill that you can take and will fix everything. There are several medications that we're still using. Actually, in our office, we do have weight loss clinic already that one of our physician assistant, Rachel, usually see those patients, and we use a few medication and also some dietary restriction and some counseling to help lose weight and exercise and all that. So what we are introducing today is a new layer, actually, which is right between the medication, the exercise, and the diet and the surgery. It's endoscopically placed device that will help with weight loss. There are several endoscopic actually methods of weight loss. We're going to talk about one in particular today, which you mentioned, the Orbera gastric balloon system. We're very excited to introduce it here. Nobody is doing it in this area here. The Orbera system has been introduced in this country in 2015. It's a little bit over a year ago. And it's been really gaining popularity in this country. It's been used worldwide for many years, more than 10 years, at least in Europe and South America. It's been used for thousands of patients with good results. The procedure itself is so we can explain it throughout the program, what are the steps and what it is. But in a nutshell, it's basically a balloon that we utilize to place in the stomach, and it will create a space occupying in the stomach, and it will prevent patient from eating a large amount, and also it will restrict the emptying of the stomach and cause a delayed emptying that will give a fullness sensation to the patient, and that's how the weight loss process usually goes. We can talk about this in more details while we, going through.
We have some pictures that we can actually show. Let's show some of the pictures, and you can kind of explain them.
You can see this, the stomach, and with the balloon that I just showed placed inside the stomach. That's how it looks like. And basically, this is the insertion process. You can see the stomach there, and the balloon will be inserted through the esophagus into the stomach. It will be inflated using a special catheter that is attached to the balloon, and then the catheter will be removed, and the balloon will be left in there for 6 months. After 6 months, we'll go back in and deflate the balloon using also a special catheter that will deflate the balloon, puncture the balloon, deflate it, and remove it. So that's the process of placing the balloon. Usually we place it for 6 months period, because that's the manufacturer recommendation, because after 6 months there's risk of the balloon puncturing or having some issues that will cause some complication. So 6 months is the recommended time for placement of the balloon.
And it's placed endoscopically.
Yes.
So talk about that procedure in a little bit more detail.
So basically, the balloon is placed through an upper endoscopy, just a regular upper endoscopy that we do on a daily basis. We'll do the endoscopy to visualize the stomach, and then we'll insert the balloon, inflate it with about 400 to 500 milliliters of fluid. We use a dye that we add to the fluid in case the balloon punctures. The substance that we use, or the dye, can be absorbed in the system, and it will come out in the urine, and we would know that the balloon is punctured, so we need to go and retrieve it so it will not pass into the small bowel and cause problems. At the end of the 6 months, we'll go back in, and like you were seeing on the pictures, we'll just puncture the balloon and remove it with another endoscopy. So there's an endoscopy at the beginning, and then there's an endoscopy at the end. The first endoscopy is to insert the balloon, the endoscopy at the end to remove the balloon.
And that is a procedure that is you're asleep for,
Yes,
but it's not.
it's like a routine upper endoscopy. If anybody had an upper endoscopy, it's just like an upper endoscopy. If you had it for, if you have an upper endoscopy for evaluation of abdominal pain or heartburn or bleeding or any other issues, it's the same procedure, exactly the same. We just use this catheter to place the balloon after the procedure.
So it really is a kind of a non-invasive or minimally invasive, I guess, procedure, non-surgical.
Non-surgical way of or an endoscopic weight loss method, if you like. There's a different balloon than this one, manufactured by a different company called Reshape. It has actually dual balloon, two of them instead of one, and you inflate the two balloons. We opted to use this one because we thought that it's going to be less discomfort for the patients than having one balloon versus the two balloons. And the weight loss results that were shown with the studies that got those two balloons approved very comparable. So we opted to go with this one versus the double balloon type.
Let's talk a little bit about the expected weight loss. And actually, to back up a little bit, there are some restrictions, not big restrictions, but there are some kind of things that you
guidelines or criteria. There's a criteria that when the FDA approval was obtained here in the U.S., the criteria is to have a BMI between 30 and 40. For this category of patient, the recommendation was made for this type of procedure. So you have to be basically an adult and have this body mass index between 30 and 40, and anybody can calculate their body mass index. There's, you can Google it. Actually, you can go and just plug in the numbers, your height and your weight in kilograms, and it will give you your BMI. So that's very simple to do. It's a little formula. You just need to plug in the numbers, and it will give you your BMI. We do BMI for every single patient that comes through the office because it's important to have that in our records. So going back to the
expected weight loss.
Expected weight loss is about 15 to 20% of the BMI.
Oh, wow.
In 6 months, yes.
In 6 months, that's pretty impressive.
It is. It is. No, it's not only the placement of the balloon, because there's also some programs during those 6 months that patients going to follow a specific diet, and they're going to follow an exercise program as well. The company provide actually something they call the Orbera Coach, which is about a session a week of interaction via Skype or via the internet with the nutritionist somewhere in the country. They will coach the patient. That's what they call Orbera Coach, and they will encourage them. They will monitor their weight. They will give them advices regarding any potential issues they're having with the balloon while they have it in their stomach. Also, we see those patients ourselves during the time of those 6 months. We dedicate once a month visit for them, and they can call the office, and if they have any questions and we need to bring them in, we can bring them anytime if they need any extra visit during that time.
About how long is the procedure to insert the balloon or then to remove it?
It's just like a routine upper endoscopy was maybe an extra 5 minutes just to insert the balloon. So it's nothing really a major difference than just a routine upper endoscopy that we do for other indications.
And that's something that you do then at your office? It's not some, or at the endoscopy center?
Yes.
It's not something that they're admitted to the hospital or anything like that?
No, it's an outpatient procedure. They come in, they have it done, and they go home after the procedure, like any other endoscopy procedure that we do.
So quite a bit different than the gastric bypass surgery.
Absolutely. I mean, this is definitely much less invasive. It's a temporary measure to kick off a weight loss program, just to give that boost of 15 to 20% of your BMI loss, and then to continue after that with the diet and the exercise to maintain the weight loss. Otherwise, most patients will gain it back.
Sure, sure. So. We've had a call come in, so I want to go to the phone.
Okay.
Hello, and thank you for calling. Do you have a question or a comment for Dr. Hakim?
Yes, I just wanted to make sure I understood when the balloon is in the stomach, how does it prevent the food from going down? Or, in other words, where does the weight loss come from?
You can see this model here. I don't know if you can see it on the screen, but this is the balloon. Actually, this is the stomach in there. So the balloon is sitting inside the stomach, so it will restrict the amount of food that you can get inside the stomach, and also it will delay any kind of food that's going to have to get around it to be able to get out of the stomach. So it will give you a fullness effect that will send signal to the brain that you are full and you're not going to eat. And then when you're going to eat, you're not going to have enough room, because the stomach also expands, and when it expands, it will give signal to the brain as well that it's full, and you're not going to have the ability to eat large volume or your regular meal. So you're going to have to eat smaller amount, and that's how the weight loss occur.
Now, will someone be able to sense or feel the balloon in the stomach?
Some patients do. I mean, I have a friend of mine actually who had it placed somewhere else, and he was telling me that sometimes when he's like exercising or walking briskly or running, he can feel the balloon jumping up and down in his stomach. So.
And then finally, the procedure itself, is it doesn't require any kind of surgery or anything like that?
No, it's just
cutting or anything like that to insert the balloon, right?
No, sir. It's just a regular upper endoscopy that we do for any other indication, and then the balloon insertion will follow that.
Okay. Well, it sounds like a good solution to weight loss. Thank you, sir.
All right, no problem.
Thank you very much for the call.
All right.
Thank you. Oops, let me get that off. Sorry about that. We have a short video.
Sure, yeah. We also have a short video that will show those steps and actually in animation when you can insert the balloon. Here it is. It's running now. So you're going through the esophagus down to the stomach. You can see the balloon. It's deflated now, and then you inflate it with the amount that you need and just let it go inside the stomach. And here you can see where the food is just sitting there. It's not getting where it needs to be, so that's how is the restriction and the food passage and the delay to the emptying, and this is the removal. We puncture the balloon and suction the fluid out and remove it.
That's fascinating. It really is interesting.
It is. It is. I mean, it's, as I said, I mean, this is new to us, new to the U.S. It's only been here for about a year. There's few places here in Florida that are doing it, but nothing in the Panhandle. Nobody in the Panhandle is doing it. But worldwide, it's been utilized for more than 10 years, especially in South America and Europe.
It's time for us to take a quick break. We have a lot more information for you. We're going to talk about this again in a much greater detail when we come back with more Health Talk.
Your word is gastroenterologist.
Can I have the definition?
A physician who specializes in diseases of the digestive tract.
Can you please use that in a sentence?
When stomach pain persists, you should see a gastroenterologist.
Could you tell me where I could find one?
The Endoscopy Center on North Davis Highway has a highly trained staff of 12 gastroenterologists who are ready to serve all of your gastrointestinal needs.
G-A-S.
Your first date. Your first job interview. Your wedding day. Your first baby. The firsts of everything can be scary, but you survive. Your first endoscopy may increase your chances to survive. Colon cancer screenings can save your life. If you won't do it for yourself, do it for the ones who love you.
The Endoscopy Center of Pensacola is an ambulatory care center designed with the patient in mind. Conveniently located on North Davis Highway, the center specializes in outpatient endoscopy. This is the direct visualization of the digestive tract with a video camera. Several different types of procedures are performed involving the esophagus, stomach, small intestines, rectum, and colon. All procedures are performed by board-certified gastroenterologists. Ask your doctor about the Endoscopy Center or call 474-8988.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy. With me tonight is Dr. Faris Hakim. He is a board-certified gastroenterologist with the Sacred Heart Division of Gastroenterology Associates. You can find him at the Endoscopy Center on Davis Highway, as well as Sacred Heart and at the Sacred Heart office in Pace. Tonight we are talking about a new device, a new system, a new procedure that's going to be offered here in Pensacola in the next couple of months, I think. And Dr. Hakim is going to be one of the ones who is doing this new procedure, using this new technology. I guess you can call it technology.
It is. It is.
It's a weight loss system, the Orbera weight loss system, gastric balloon weight loss system, I guess the full name of it. It's a fascinating thing that we've been talking about this evening. We have some models, we have one of the actual balloons that you can see. Before the break, we were talking with a caller who was asking, how does the weight loss actually happen? So it happens because it's taking up space in the stomach.
Right. I mean, you can see the balloon right here. This is the orange here. This is the stomach, and you can see the balloon sitting in the stomach and taking, part of the space inside the stomach. And whenever you consuming food or liquid, it's gonna sit on top of this, and it's gonna take time to move around and get out of the stomach. So that basically is creating a restriction to the food passage through the stomach and delaying it to the point that you're gonna not be able to consume the amount that you usually do on a regular basis, and that's how the weight loss occurs.
So it's really a portion control. It's the restriction of how much you can have in your stomach at a time.
Exactly. And this is the actual balloon. That's actually the balloon that we place in there. So this is, it's bigger than this. This is just a model. This is the actual balloon. So.
And you mentioned how the size of that, between 400 and 500 milliliters in that. Right. How large is the actual stomach, the capacity of the stomach?
Capacity of the stomach, about 1,500.
So about a third of the size.
The stomach, yes.
And so, as you can see, that is certainly going to, and of course I was surprised by how big that was. That looks like it would take up a lot of the stomach. But that's kind of what you want, because you do want that feeling of fullness, and then you obviously want it to keep you from eating too much.
Yes, that's the purpose, and that's the goal, actually, to precipitate the weight loss, basically.
And it's not only, since this is a temporary solution, you said that it's recommended for no more than 6 months.
Right, because the company, they only want to use it for 6 months because of fear of the balloon deteriorate or puncture.
Well, stomach acid is a serious thing.
Exactly, so they do not really want to leave it there more than 6 months, fearing those problems, because if the balloon deflated and the liquid is out, so there's a potential of passage of the balloon down to the small bowel, causing obstruction and surgical and emergency. So they definitely don't want that to happen, and that's the reason we put in that dye in there, so we would know if that got deflated, it will be smaller and might be passable through the pylorus, or the exit of the stomach is called the pylorus, that leads to the small bowel. So the 6 months period, it's the one that's been approved, and non-conventional situation, especially not in the U.S. It's not been done here. People are just removing a balloon and putting another one in case they're required to have it for a longer period of time, so an extra 6 months or something like that, just to make sure that the balloon integrity will be maintained. Right. So that's an option, and I have not really, we're just learning this, and from the U.S. experience, as I said, this has been approved by the FDA in September or August of last year. Excuse me. So we're just learning here, and I haven't heard from the courses that I've been to anybody who attempted doing that for more than 1 6 months period yet. But I think most probably that can be done. It's not going to be a big issue.
I know that one of the things, and of course is a website that you can kind of go to and get some more information about this particular product. The Orbera website is very, very helpful. There's also some brochures that they have at the Endoscopy Center, and you can get a copy of the brochure that has some of the information.
Yeah, they can just call the number, and then we can mail it to them, and they can look at it, or they can just go on the website orbera.com, and they will find a lot of patient information and a lot of questions answered in there.
We have a call that's come in, so I want to get to the phone. Again, we're going to be talking about this in quite a bit more detail.
Yes,
so
yes, we will.
We'll get to the caller. Hello, and thank you for calling. Do you have a question or a comment for Dr. Hakim?
Yes, a couple. I'm a spinal cord injury patient, and I don't get to do a lot of exercise. So I have put on a lot of weight, and I do take a lot of medication. And I was wondering, having one of these balloons in your stomach, and you're on a lot of medications.
What medication? Are you taking any blood thinners?
No. Everything from narcotics to anti-inflammatories to anti-depression, anti-anxiety medications.
Okay. Well, I don't think there's any, I mean, maybe blood thinners might be something to be concerned about, just because if you develop some erosions or some irritation in the stomach lining from the balloon being inside the stomach. But the other medication, I think it has to be reviewed one by one and make sure that there's no contraindication for the balloon. But I don't think from the one that you mentioned, anything really pop up for me to say, no, you cannot have it. So if you are interested, you can contact us, and we'll be happy to bring you in for a consultation, and we'll see if you'll be a candidate or not.
Okay, and one other thing, does insurance cover any of this?
Unfortunately, at this stage, they are not covering it. So it's the same as weight loss surgery or bariatric surgery. Most insurances do not cover it unless there's a special circumstances. We were talking about this earlier, actually, before the show. But at this point, this is a cash procedure. It's not really covered by the insurance companies.
Okay, well, thank you very much.
You're welcome, sir. Anytime.
Thank you very much for the call. So at this point, as he brought up, it's an elective procedure. This is not something that is typically medically indicated or something like that.
And some very specific selected patients, it might be, but the majority, 99% of those procedures are elective, and because patients would want to lose weight, because that's the goal of a lot of people, and it will enhance that experience, or kick it off to a higher level. Like a patient who have this method will have 3 times the amount of weight loss just compared to just diet and exercise.
Wow.
In those 6 months period. So that is really helpful, and it will they comply with the same lifestyle and diet. Hopefully that weight will stay off after this removal of the balloon.
And that's something that I want to talk about in a little bit more detail here too. When you do have this inserted and you have the balloon, that's not it. I mean, you do have a diet coach or a dietitian, a nutritionist, someone like that, your Orbera coach.
Yes,
that's
the Orbera
coach
that I mentioned, that's provided by the company, and it's a Skype interview, 24 of these during the 6 months, like once a week. Basically, you interact with your dietitian, and the same dietitian will stay with you throughout the time, and they will address all your questions and go over your diet and things that you're supposed to do, advise you on exercise and things like that. And some practices, they're doing a local, if they have a nutrition. We do not have a nutrition on staff, but we were entertaining the idea of having a nutritionist on the staff. So if we do in the future, we might utilize our own nutritionist to see those patients instead of going through an online service. But some practices do have that service available, and we don't really have to have that nutritionist in our practice. I mean, there's plenty of nutritionists here in town that we can, cooperate with and create a program that be helpful if the patient would benefit better just having an actual interaction instead of online interaction.
One of the things that it mentions online and in the brochure as well is that a lot of the weight loss occurs, the most significant amount occurs within the first 3 or 4 months.
Right.
But you keep that in for 6 months because one of the things that's important that you do is learn that portion control, learn the proper amount to eat to then maintain that weight. So then when the balloon is removed, you're not overeating. You're still eating the same amount, and then that's going to continue to maintain the weight without the balloon.
That's true. Absolutely. Yeah.
So I thought that was interesting because it's, again, one of the kind of most important pieces of it, since this is just something that's temporary.
Right.
You don't want to gain all the weight back as soon as it's out.
Absolutely. So, I mean, if you want to go through all this and the expense and putting up with this sitting in your stomach for 6 months, so I think that should be enough motivation to maintain that weight loss after the removal of the balloon.
And I think that that's a great thing, and I like the idea of having somebody that you can kind of be accountable to once a week.
Right. That will be a lot of incentive for the patient because they know they're going to meet with that person. If they're not, following the instruction, they're going to get on them and say, well, why are you doing this? Or why are you not supposed to do that? Or are you supposed to do this? So I think it's very helpful, and they will feel like they have somebody that is checking on them and guiding them through the process, and it's a very good idea actually.
One of the other things that you kind of briefly mentioned, and I want to kind of bring up again, not only is it just taking up space in the stomach, so you're eating a little bit less, but it seems as if it's almost controlling hunger in a way because it's kind of telling your body you're full.
Exactly. I mean, because there's sensors in the stomach, or bariatric sensors that will sense the amount of fullness in the stomach, and when those are basically triggered, so that will signal to the brain that your stomach is full, so you don't feel hungry and you don't feel like you need to eat. So that's also another way of it helping with the weight loss.
Are there any medications that are required for someone to take once they have this?
One of the most side effects or the most problems that patients encounter is nausea, and anti-nausea medication definitely is available in several strengths and different brands that we utilize for that purpose. Dehydration sometimes can occur because people are not really consuming enough liquid, and that's going to be something very important for patients to try to drink as much fluid as they can, especially in the first few days, to really maintain adequate hydration. On some occasions, some patients do not, and then we're going to have to bring them to the office and just give them IV fluids just to maintain their fluid status, especially in the first few days. But the majority of patients are able to really at least keep fluid. They might not be able to eat much because of the fullness in the stomach initially, but that's the whole purpose. But fluid is much easier to tolerate than just regular food.
So the first few days are probably the most...
Yes, the first 48 to 72 hours from the I haven't really done any patients yet, but from the courses that we went to, and we listened to a lecturer who done thousands of patients, and this is what we were told, that the first 48 to 72 hours is the toughest period, and patients who are going to have problems. Some of the patients, they don't have any problems, they will just be fine. So everybody is different, depends on their sensitivity to the presence of something in their stomach, how they feel with that, and it's something that we're not going to be able to tell until we place the balloon. So there's no test
test that we can do ahead of time to tell, oh, well, you might not be really a good candidate because you have hypersensitivity or no. So it's going to be, it depends on individual patients. So they said the majority of patients will have some problems in the first 2-3 days, but after that, the rest of the period, that's majority of patients do fine.
Your body is very adaptable, so
yes,
I think it
exactly.
kind of figures out, oh, okay, so there's something new here, and now I figured it out,
right.
now I can
right.
go from here.
Yeah.
It's time for us to take another quick break. We have a lot more information. We will be right back with more Health Talk.
Your word is gastroenterologist.
Can I have the definition?
A physician who specializes in diseases of the digestive tract.
Can you please use that in a sentence?
When stomach pain persists, you should see a gastroenterologist.
Could you tell me where I could find one?
The Endoscopy Center on North Davis Highway has a highly trained staff of 12 gastroenterologists who are ready to serve all of your gastrointestinal needs.
G-A-S.
Your first date. Your first job interview. Your wedding day. Your first baby. The firsts of everything can be scary, but you survive. Your first endoscopy may increase your chances to survive. Colon cancer screenings can save your life. If you won't do it for yourself, do it for the ones who love you.
The Endoscopy Center of Pensacola is an ambulatory care center designed with the patient in mind. Conveniently located on North Davis Highway, the center specializes in outpatient endoscopy. This is the direct visualization of the digestive tract with a video camera. Several different types of procedures are performed involving the esophagus, stomach, small intestines, rectum, and colon. All procedures are performed by board-certified gastroenterologists. Ask your doctor about the Endoscopy Center or call 474-8988.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy. With me tonight is Dr. Faris Hakim. He is a board-certified gastroenterologist with the Sacred Heart Division of Gastroenterology Associates. Tonight we are talking about a new weight loss system that they are going to begin installing, I'm not sure the proper terminology for putting it in to patients. Installing. Sure, I'm not sure. But anyway, they're going to be starting to use it with patients pretty soon, in the next couple of months, probably after the first of the year. So it's something that we're just learning about. It's new to this area, although it's been approved by the FDA for about a year or so in this country. There's no one here in the Panhandle that's doing it. So this is going to be something that's new and exciting. It is a minimally invasive, non-surgical procedure that will assist greatly with weight loss. So we have some models. We have an actual balloon that is inserted into the patient's stomach. We've been talking about it in some detail. I want to talk about maybe a potential downside of this. You mentioned, Dr. Hakim, when one of the callers was speaking with you about possible erosions or ulcers or something like that from having it in the stomach. Is that a potential side effect? What are the chances of something like that
There's
happening?
a few side effects, but nothing really significantly major. The endoscopy itself, for the insertion and the removal, there's always risk with the endoscopy. It's very minimal. There's always risk for bleeding or perforation. That happens very, very rarely. The complications that are related to the balloon per se, it's mainly nausea. That's the biggest one that's been seen with patients who had this done. And that usually is well controlled with using medications. I mean, we have a long list of anti-nausea medication that we use for nausea in general, and these are the same medication that we use for those patients, and that's 99 I would say 99% of patients is very effective in controlling the symptoms. And the nausea, usually it's in the beginning, like we mentioned, the first few days, and then the body will adapt to the presence of this balloon in the stomach and would not require really significant medication. Other things, we talked about the balloon puncturing or getting damaged somehow, and then the fluid that is filling it passing, that will make the balloon passable possibly through the pylorus, which is the opening of the stomach into the small bowel. And if that happens, it can create an obstruction in the small bowel because of the size of the balloon. And that would be also one of the potential complications, but that's also very rare. And to really catch this and very early, as I said, we add a dye to the fluid that we fill the balloon with that will alarm the patient that the balloon was punctured, because they will see a change in the urine color to blue if they have that going through their stomach and they get absorbed, the dye get absorbed in the small bowel. Ulcers and erosions also have been reported, but that also very small percentage of patients will develop that, and we can figure that out just by having those patients complaining like anybody else has an ulcer, basically, and we can do an endoscopy while this balloon is in there, and we can take a look and see if there's any really problem there, and then we can put them on medications to help heal the ulcer and treat it like any other ulcer. Nothing really other than that majorly reported, but these are the major potential associated side effects from placement of this balloon.
Have there been any instances where they are noticing more reflux or anything like that?
Yes, there was an increase of reflux because of the delayed emptying, because we basically creating what we call gastroparesis, or delayed emptying of the stomach, and sometimes if the accumulation of the fluid in the proximal portion of the stomach will facilitate regurgitation or heartburn or things like that, and that can be prevented by having less amount of volume, and that will contribute to the main goal of weight loss, basically.
I want to show the video again.
Yes,
if we
can show the video. It's an animation video about insertion of the balloon.
One of the things that we kind of mentioned quickly, and I asked you actually during one of the breaks, is there a chance that it could block the bottom, where the food is leaving the stomach? And you were saying, no, not really, it's too big to...
Right, it's too big to pass into that exit of the stomach, so it's going to be very hard while it's filled to pass through that. But as I said, for some reason it got punctured, like it get puncturing now for the removal, like you see in the video, and that will make it much smaller, then it might be passable through that area. So unless it's deflated, it's not going to pass from the stomach. It's definitely going to stay in there.
And that also showed as you were eating the food kind of coming in, and it kind of goes around the edges.
It sits on top of it because it's sitting right there. The stomach shape is like a J shape like that, and it will stay here, and then we'll try to seep around it, and that's the delayed emptying and the restriction effect that the balloon create, and that's how it works, basically.
So it's not actually like stopping it up; it's just slowing it down.
Exactly,
so it takes longer to get around
the stomach is going to be moving. There's a peristalsis, so the stomach is going to be moving around it. So this food will just seep around it and get down to where it's supposed to be and get out of the stomach.
Are there any particular food restrictions after you've had this procedure? Things
not
you
really.
have to avoid?
Not really. We were told to encourage patients to drink raw fluids because there's a risk of dehydration, because they do not really drink raw fluid because they'll try to have more food than fluid, because they only can have small amounts. But fluid is very important to drink as much fluid as possible to prevent dehydration.
But nothing that you have to avoid?
Nothing really you have to avoid, unless you try to swallow a sharp object or something. It's going to puncture the balloon.
Not be good. So really it's just smaller portions. It's that portion control, and since it is smaller portions, probably the healthier the better.
Right, absolutely. Yeah,
If you're trying to lose weight, that's
exactly
better anyway.
Exactly,
So.
absolutely. I mean, of course. I mean, if you're trying to lose weight, you're just gonna try to use healthy food, and there's no restriction basically on what kind of food you can have.
And the Orbera coach is going to be vital in helping you determine
Yes.
what are the best foods to have, what are the portions that are going to be.
That's basically all of these are going to be certified nutritionists that are doing the coaching, and they will give you all the details about the dietary element that you can use during this, or if you have any questions about specific kind of food, they will address it. I think, I mean, we met a few of those people in the course that we attended, and they appear to be very knowledgeable, very helpful in what they do. So I think that would be very good. So
I would imagine that one of the other things that this encourages is eating smaller portions, but more often, possibly throughout the day, because you don't want to have a big meal. You don't want to sit down and have
actually that's what we
dinner.
tell patients who have gastroparesis, that they have the disease gastroparesis, that we're trying to create a model of here, to have smaller portion more frequent, and that's what that does, mimic that gastroparesis effect.
So again, it kind of takes a little bit longer to go through, but a more steady supply instead of a whole lot at once trying to move is going to probably be a little bit easier.
Sure. Yeah.
So again, we talked about this being kind of a temporary thing. It's for about 6 months. What kind of supervision is required by a physician, by you, during the time that a patient would have this in place?
As I said, we'll bring the patient to see us at least 3 to 4 times during the 6 months period, and that's included in the process or in the treatment. If they need to come in more frequent, we'll always be accessible like we always are for our patients. They can call and come in if they need to come in, or they can have any issues we can resolve over the phone. Of course, we have our MAs and our mid-levels and us available all the time to help patients in that regard. So.
All right, it's time for us to take our last break. If you have a question or a comment about this particular procedure, we'd love to hear from you. We'll be back in just a minute with more Health Talk.
Your word is gastroenterologist.
Can I have the definition?
A physician who specializes in diseases of the digestive tract.
Can you please use that in a sentence?
When stomach pain persists, you should see a gastroenterologist.
Could you tell me where I could find one?
The Endoscopy Center on North Davis Highway has a highly trained staff of 12 gastroenterologists who are ready to serve all of your gastrointestinal needs.
G-A-S.
Your first date. Your first job interview. Your wedding day. Your first baby. The firsts of everything can be scary, but you survive. Your first endoscopy may increase your chances to survive. Colon cancer screenings can save your life. If you won't do it for yourself, do it for the ones who love you.
The Endoscopy Center of Pensacola is an ambulatory care center designed with the patient in mind. Conveniently located on North Davis Highway, the center specializes in outpatient endoscopy. This is the direct visualization of the digestive tract with a video camera. Several different types of procedures are performed involving the esophagus, stomach, small intestines, rectum, and colon. All procedures are performed by board-certified gastroenterologists. Ask your doctor about the Endoscopy Center or call 474-8988.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy. With me is Dr. Faris Hakim. He is a board-certified gastroenterologist with the Sacred Heart Division of Gastroenterology Associates. Tonight we are talking about a new system that Dr. Hakim and some of his associates are introducing to this area, the Orbera gastric balloon weight loss system. It's quite an interesting procedure and device. We've been talking about it in some detail throughout the evening. If you have a question or a comment about obesity or about this specific procedure, we'd love to get your call on the air. So give us a call. The numbers are on the screen, 432-7768. Or if you're outside of the Pensacola area, the toll-free number is 1-800-950-2522. Again, this is something that we've talked about a few times, that it is temporary. It stays in for about 6 months. And I was asking during the break, are there long-term studies about how effective is it? How do people keep the weight off after it's removed?
I'm not aware of the really long-term studies, but I think it's all depending on the individual patient. I mean, if the patient is really benefited from the 6 months weight loss period and stayed compliant with the restriction that he had and the exercise program, whatever he was doing during the 6 months, definitely going to have a long-term lasting effect. But if they're going to revert back to their old habits and not follow the restriction that they have during the 6 months, I mean, it's a no-brainer. They're going to gain that weight back. So it's going to be how disciplined is the patient, and how compliant and how adamant they are to keep that weight off that they were able to shed with the help of this device. I'm not really aware of any long-term studies that were done, because most of those patients after this, so they're not going to follow up with those particular doctors. So I don't think there is any, but they might have some on the Orbera. I don't recall seeing any, but they might have some of those if they are available on their website there. So
I would imagine that the kind of hope, the plan is, once you've developed the habits over 6 months, the
Right.
exercise habits, the eating habits, the nutrition, the types of food that you're eating, the portions that you're eating,
Yeah.
you really have developed that into part of your lifestyle.
Right.
That hopefully moving forward, that continues to be part of your lifestyle, and so you
yeah,
can
I mean
maintain the
that's
same
what give you
weight.
like a little kickoff to start that process basically, and you're gonna lose good amount of weight over the period of 6 months, and then if you can keep that weight off and just build up on it, I think that will be very helpful. I think this is gonna be we're still learning, as I said, about it. I mean, it's just been available in this country for a year, and we, just gearing up for the program. We're trying to formalize the steps and the checklist for the patient, the procedures that they need to have, and what is the requirements and the criteria for starting the program. So we're still in the beginning, and we're hoping that this is going to be something that we're going to utilize over the next few years and help patients losing weight.
I want to show the video one more time. I know we've showed it a couple of times.
Yeah,
but
the video is very informative. I mean, it just showed the animation of how simple the insertion is. This is the balloon that you can see it going down to the stomach and being inflated. The black is the actual scope, so we doing it under direct visualization. We inflate it, and then we'll remove the filling catheter out, and that's so it looks inside the stomach.
Kind of moving
and
around
this is at
it.
the time of the removal. We'll put the scope in, and we have a special device that we can insert it inside and suction all the fluid out, and then just remove the balloon with the scope at the end of the 6 months period.
It really is amazing the ease with which this is inserted, because the gastric bypass surgery or the bariatric surgery.
This is the completely different category. As I said, I mean, this is not invasive at all. There's no surgery involved. It's just an upper endoscopy and insertion of the balloon, like you saw in the video. It's very simple and straightforward. It's temporary. That's the main difference, because the bariatric surgery is permanent and much more effective, of course, than this. There's other endoscopic method actually other than the balloon that's been introduced, and they're actually in some big centers now they're doing some studies about doing gastroplasty or bariatric surgery endoscopically.
Oh.
Yes,
Well,
without surgery. So that's something that is going to be coming up, but it's still in research at this time, and it's not going to be available in private practice. Most probably it's going to be in big centers like Mayo Clinic and Harvard and big centers like that.
Well, again, this is something that's a fascinating new procedure that's coming to this area.
Yes.
You will be the only ones doing it for a while.
Yes, I mean,
here.
we are a center of excellence at the Endoscopy Center, and we, we pride to bring all the new the techniques and all the new method that's available to help our patient. And we thought that this might be something to introduce to our community, and we will see what the response will be. And as I said, we are just gearing up, putting the program together, and we're gonna hopefully start maybe beginning of 2017 if we have patients to come in and be interested, evaluated, and sign up for the program.
If you want more information, certainly contact the Endoscopy Center. They can send you one of the brochures. They have some great information in here. You can also go to the Orbera website. It's ORBERA. You can search for that, or you can just go to orbera.com, ORBERA.com, and that has a lot of information on that as well, on the procedure as well. If you have questions or comments, call the Endoscopy Center. They'll be more than happy to speak with you about that. If you can't find something online and you just want some more information, make sure that you do that. It's something that's new. It's something that's different. It certainly is something that is seeming to be, at least, very effective.
It is. It is. And it's been shown to be effective. And we're hoping that we can utilize it more often.
And it seems to be well tolerated by most patients.
Yes, yes. I mean, as I said, I mean, the side effects that I mentioned are the major ones that can occur, and they're all easily manageable with different things. The dehydration with fluids, nausea with nausea medication, and things like that.
Well, I know that there's a lot of people that are looking forward to getting more information, learning more about it.
We'll be happy to hear from them, and we'll be happy to bring them in and see if they will be interested in something that would be helpful for them.
And the next time we'll have you on, we'll be talking about how successful it has been.
We hope so. Thank you very much.
Thank you so much for joining us. We hope you join us again when we come back next month with more Health Talk.